Want to do a video concerning this very procedure that is often carried out on ladies that are looking for the fruit of womb, hysterosalpingography. And what is this hysterosalpingography all about? It is a procedure that is usually carried out on a woman, you get, in order to dictate or to know the patency of the tubes and its environment, the uterine wall and all that. And it is often carried out on an infertility cases, and also where there have been consistent miscarriages, you get. And sometimes during the course of this very procedure, when a contrast is being injected, it will now follow, and that contrast is often a dye. It will now go through the uterine cavity and spill through the fallopian tubes. But if there is no spillage, that means that that fallopian tube has a problem. And mind you, this very hysterosalpingography is an X-ray. It's an X-ray. And with that, you can dictate whether there is submucosal myoma. What do I mean by that? Myoma, that we often call fibroid, whether there is anyone situated inside the uterus where the baby will embed, after which it has passed from the fallopian tube, where the baby will now stay. It will now help to dictate whether there is any submucosal myoma there. And again, we can also use that to dictate whether there is synarche, a kind of adhesions, you get, and other things that you can discover using that salpingography. And most of the times, people usually discourage some because there's maybe like that is always a painful procedure. Yes, it is always a painful procedure, but it's a procedure while worth doing for a woman that has problem with infertility or her fertility problems, you get. But mind you that this very procedure cannot be carried out on a woman that is pregnant, on a woman with pelvic infections, and on a woman with that bleeds, you get. You cannot use such procedures on that woman. And mind you that whenever after using that procedure and after that procedure, and they find out that maybe that the tubes, because you can use that very procedure to dictate whether the tubes are patent. So having find out that maybe that there is blockage in fallopian tubes, a procedure called hydrotubation is often done or carried out in order to open that fallopian tubes. And this, after these very procedures, many women often conceived or conceives. So what am I trying to say? That when you must have seen a gynecologist and he advises that you should go for that very procedure, hysterosalpingography, don't hesitate to go for it. Don't mind what people are telling you, probably that is painful and all that. Even if it is painful, please endure it. Most of the times after, they usually give the patient analgesic, which will help to damp the pain. So with this, you can see that this procedure is worth doing, you get. So make this very video to always go viral, because a lot of people are going to benefit from it. Thank you.